Right. So, a very good morning, everyone. So, I welcome you all to this particular session on the image-based questions. So, in this particular session, I will be discussing the images related to your gastroenterology. That will be for half an hour, right? So, I will try to discuss as many as images as possible related to your gastroenterology. Okay. Right. Let me take up the first question. And I am myself, yes, Arya Ajesh, good morning. I am myself Dr. Rajesh Guba. I am the General Medicine Educator for the Arise Medical Academy. So in order to see that you should not face any difficulties in your clinical based or your image based questions related to your general medicine, every day we are conducting the clinical based and as well as image based questions on YouTube Live. So please try to utilize these sessions and take the advantage of these sessions in cracking your FMGE exams, right? So let me start with the first question. Yeah, you see this question. Contraindication for a procedure shown in the photograph: Wilson's disease, autoimmune hepatitis, hemangioma, chronic hepatitis B and as well as C. Contraindication for procedure shown in the photograph. Yes, so please answer this. So the procedure which is being done here is the liver biopsy. Right, the procedure which is being done here is the liver biopsy. Now, among the following, in which clinical condition you don't do liver biopsy? Wilson's disease, autoimmune hepatitis, hemangioma, chronic hepatitis B and as well as C. Yes. So, yes, any one of you please attempt this question. Right, very good, Arya Ajesh. So the answer is hemangioma. So in hemangioma, we don't do liver biopsy, right? Yes, Arya Ajesh, what you have said is correct. So in hemangioma, we don't do the liver biopsy. In remaining all, they are the indications for your liver biopsy. Now, these are all the indications for liver biopsy. That includes NASH, non-alcoholic steatohepatitis. Okay, next, chronic hepatitis B and C, autoimmune hepatitis, amoebic liver abscess, primary biliary cirrhosis, primary sclerosing cholangitis, hemochromatosis, and Wilson's disease. So these are all the indications for liver biopsy, right? These are all the indications for liver biopsy, okay? Now the other important point is you should be very much aware of what are all the needles which are used for the liver biopsy. The needles what we use for the liver biopsy, we have the suction needle, cutting needle, and as well as spring-loaded cutting needles that have a triggering mechanism. And what are these suction needles? They include Mengeni, Klatskin, and Jamshidi needle. Cutting needle, right? We have Wim Silverman and as well as the True Cut needle. Wim Silverman and as well as the True Cut needle. So the contraindication for procedure shown in the photograph, it is your hemangioma. In remaining all these conditions, we definitely do the liver biopsy. And Wilson's, it is the one which will cause macronodular cirrhosis. Right? It is the one which will cause the macronodular cirrhosis. And in case of Wilson's, it is the disorder which is characterized by excessive copper accumulation in the liver. Right, excessive copper accumulation within the liver. So that is what is your Wilson's disease. All right. Next, followed by that, we will move on to yes. And you should be very much aware of how the Wim Silverman needle appears. So this is your various parts of the Wim Silverman's needle. So this is the needle actually. then we have obturator, outer sheath, and as well as the cutting prongs. So this is your Wim Silverman's needle, which is used for the liver biopsy. So please remember this. This is very, very important. Now, you see the next question. What is the false statement about the diverticulum shown in the photograph? It's a pre-malignant condition. Dysphagia will be there. Location in the Killian's triangle. Regurgitation of the previous day's food. So what is the false statement about the diverticulum which is shown in the arrow? So this is your arrow. Yes, any one of you please answer. So first of all, can anyone tell me what is the diagnosis? What is this name of this diverticulum? Yes, what is the name of this diverticulum? Right. So this particular diverticulum, it is your Zenker's diverticulum. Okay. So this Zenker's diverticulum, it is a pseudo swelling or the pseudo pouching. All the layers of the esophagus will not be there in case of your Zenker's diverticulum. And Zenker's diverticulum, it is not a pre-malignant condition. So the question asked is, what is a false statement? So what is a false statement about the diverticulum here? So it is not a pre-malignant condition. Okay, so it is not a pre-malignant condition. So this is a very, very important point that you need to remember. Next, the other point is, in these patients with the Zenker diverticulum, the clinical feature is in the form of dysphagia. The clinical features is in the form of dysphagia. And it is located in the Killian's triangle, right? That is also a true statement or the correct statement. Now, let me tell you what is the Killian's triangle, right? Let me tell you what is your Killian's triangle. So the Killian's triangle, yes. So this is your Killian's triangle, right? This is your Killian's triangle. Now, where is the Killian's triangle present? The Killian's triangle, it is present. It is formed in between the cricopharyngeus muscle and as well as the inferior pharyngeal constrictor muscle, right? It is formed between the cricopharyngeus and as well as the thyropharyngeus. What is this thyropharyngeus? Thyropharyngeus, it contains the two parts, that is nothing but your inferior constrictor muscle, right? The thyropharyngeus, it has two parts, that is nothing but your inferior constrictor muscle. Okay, so that is, and from this particular Killian's triangle, you have this outpouching. You have this outpouching, and that is what is called as your Zenker's diverticulum. That is what is your Zenker's diverticulum. Okay, so it is not the pre-malignant condition. Dysphagia will be there, located in the Killian's triangle, and regurgitation of the previous day's food will definitely be there. Why? Because the food which has been taken, that can get accumulated in this out pouch. Okay, that can get accumulated in the pouch, and from the pouch it can enter, and then there can be regurgitation. So regurgitation of the previous day's food can be there in this clinical scenario. So the false statement about this particular diverticulum is, it is not a pre-malignant condition. Okay, so that's a very important point that you need to know, right? Now, after having discussed about the image on Zenker's diverticulum, now let me move on to the next question. Yes, the fever pattern shown in the photograph is found in brucellosis, enteric fever, relapsing fever, Hodgkin's lymphoma. The fever pattern shown is found in, right? So you see the baseline temperature is 37, then 38, then 39, then 40. So what is this pattern called? Right? What is this pattern of fever called? And where will you have this particular pattern of fever? Right? Where will you have this pattern of fever? Anyone? Any one of you? Fever pattern shown in the photograph is found in, right? So this is called as, right, very good Arya Ajesh. So this is called as stepladder fever. Right, this is called the stepladder fever. Okay, now where will you have this particular stepladder fever? You will have that in patients with the enteric fever. So in enteric fever, you will have that particular stepladder fever. Okay, so this is a very, very important point. Now can anyone tell me what is the type of fever in case of the Hodgkin's lymphoma? Right, this is another important image-based question that can be asked. I will show you the image of this particular pattern of fever, what you will see in case of the Hodgkin's lymphoma. But please tell me, what is the name of the fever you get, or the name given to that fever, what you get in case of the Hodgkin's lymphoma? Right, there is a peculiar name, and that's an important multiple choice question as well. Fever pattern shown in the photograph is found in. Yes, any one of you? In Hodgkin's lymphoma. Right, so the fever pattern, what we call in case of the Hodgkin's lymphoma is Pell-Epstein type of fever. Right, that we call it as Pell-Epstein pattern of fever. Right, you see here, this is your Pell-Epstein pattern of fever. Right, this is your Pell-Epstein pattern of fever. So it is a rarely seen condition known in patients with the Hodgkin's lymphoma, okay, in which the patient experiences fevers which clinically increase and decrease. So you see here, there is increase and as well as decrease over an average period of 1 to 2 weeks. Right, and over an average period of 1 to 2 weeks. So that is what is called as the Pell-Epstein fever, which is seen in case of the Hodgkin's lymphoma. Now, at this moment, let me explain you all the types of fever. See, we have various patterns of fever. We have what is called continuous fever. We have what is called intermittent fever. We have what is called relapsing fever and remittent fever. So these are all the various patterns of the fever. Now, they can show you any of this particular image and they will ask you what is the pattern of the fever or what is the condition where you will have this particular pattern, right? So this question, they have asked you about the stepladder fever. And where will you have stepladder fever? That is in enteric fever. The answer here is B, enteric fever. So similar way, they can show you the images of various patterns. Now, first let me give you the description and then I will show you the pattern. So we have what is called intermittent fever. What do you understand by the word intermittent fever? Intermittent fever is that the fever will be there only for several hours, and then once the fever reduces, it will touch the baseline. So what will be your baseline? Either 37.6 degrees centigrade or it will touch your 99.4 degree Fahrenheit. So it will touch the baseline. So accordingly, we have three types of the intermittent fever. One is quotidian, tertian, and quartan. Quotidian, the paroxysms of the fever occur daily. Every day you have this particular spike of fever. Tertian, the paroxysms occur on alternate day, right? Not every day, alternate day. Quartan, 2 days, when 2 days intervene between the consecutive paroxysmal attacks, that is called as the quartan fever. That is called quartan fever. So these are the three types of the intermittent fever: quotidian fever, tertian fever, and quartan fever. So this is what is your intermittent fever. Okay, next. Then we have what is called continued fever. Now, what do you understand by this word continued fever? The fever does not fluctuate more than 1 degree during the 24-hour period, and it will never touch the baseline. What is that we have discussed in the intermittent fever? In intermittent fever, the fever will touch the baseline. Okay, whereas continued fever, the temperature will be above the baseline throughout the day, and it does not fluctuate more than 1 degree centigrade. Right, does not fluctuate more than 1 degree centigrade. Now, then we have remittent fever. Remittent fever, there will be daily fluctuations of the fever of more than 2 degrees centigrade, and it will never touch the baseline. What was your continuous fever? Continuous fever, the fluctuation will not be more than 1 degree centigrade. Right? Fluctuation will not be more than 1 degree centigrade. Whereas remittent fever, there will be daily fluctuation of the fever, and that particular daily fluctuation will be more than 2 degrees centigrade within the 24-hour period, and it will never touch the baseline. Now, let me show you the patterns. Right? This is your pattern. So this is your sustained or continuous fever. Right? This is your sustained or continuous fever. That means what? This is your baseline. Okay, so in continuous fever, the fever will not touch the baseline, and alteration will not be more than 1 degree centigrade. Right, the fluctuation will not be more than 1 degree centigrade. Then you take the intermittent fever and as well as the relapsing fever. In intermittent fever, what did I tell you? It will touch the baseline. Right, it will touch the baseline. Okay, and you take the remittent fever. In remittent fever, again, it will not touch the baseline. Right, it will not touch the baseline. But how much will be the fluctuation? The fluctuation will be there. Right, fluctuation will be there of more than 2 degrees centigrade. Right, fluctuation will be there of more than 2 degrees centigrade. Whereas in relapsing fever, initially it will be intermittent and later it will turn into, initially it will be remittent and later it will turn into intermittent. Okay, so that is what is your continuous fever, intermittent fever, remittent fever, and as well as the relapsing fever. So you should know the patterns of fever, and in the present question which has been asked to you, the fever pattern shown in the photograph, it is nothing but your stepladder fever seen in enteric fever. And the other very important image that will be shown for you is your Pelebstine fever. This is the image of Pelebstine fever, and you will have this Pelebstine fever in case of the Hodgkin's lymphoma. So please remember these 2 points. Okay, right. And already I have discussed the various types of fever: intermittent, continued, and as well as the remittent fever. Okay, right. Now we will move on to the next question. Yeah. Most sensitive test for the organism shown in the photograph is fecal antigen test, biopsy urease test, serological test, urea breath test. Now, let me tell you to all the students that on the platform of Arise Medical Academy on YouTube channel, every day I am doing this particular clinical based or image based questions. So please don't miss watching the previous sessions also, which they will be very much useful for your upcoming FMGE exam. And I have also taught you how to analyze the clinical based questions. So please watch all the sessions which will be definitely useful for your upcoming FMGE exam, right? No. What is the organism? Yes, Mohammad Karimuddin. What is the organism? The organism is the H. pylori. Right? And what is the most sensitive test? The most sensitive test is the biopsy urease test, right? So only one student, that is Arya Ajesh, has answered it. Very good. So biopsy urease test is the most sensitive test for your H. pylori. And H. pylori, it is the one which will cause the peptic ulcers, right? Which will cause the peptic ulcer. So what do? We do an endoscopy, right? We do an endoscopy and we will take a biopsy tissue, right? We will take out a small material from the gastrointestinal mucosa or from the duodenum, and we do a urease test for that, and that will, if the organism is H. pylori, that biopsy urease test will demonstrate the presence of this particular H. pylori. Now, regarding the H. pylori, one important question that you need to know, the treatment of the H. pylori. So in the treatment, remember, we have triple drug regimens, then we have the quadruple drug regimens, right? We have triple drug regimens and as well as the quadruple drug regimens. Now, what are these regimens? You should be very much aware of. Triple drug regimens, what are those three drugs? Number one, proton pump inhibitor. Number two, amoxicillin. Number three, clarithromycin. So these are the three drugs in the triple drug regimen, right? These are the three drugs in triple drug regimen. In quadruple, as the name itself suggests, it includes four drugs. That includes number one, proton pump inhibitor. Number two, tetracycline. Number three, bismuth. Number four, metronidazole. Right? Number four, metronidazole. So these are the quadruple therapy. Right? This is your quadruple drug regimen. So the triple drug regimen, you can give it for nearly around 7 to 14 days. And the quadruple regimen can also be given around 2 weeks. Okay. So this is about the treatment of the H. pylori. Now, what is the question that will be asked for you in the treatment part? What they can ask you is, they will give you four options. Which among the following drug is not used in the treatment of H. pylori? So they will give you proton pump inhibitors, they will give you amoxicillin, they will give you clarithromycin, and they will give you ciprofloxacin. So what will be the answer? Ciprofloxacin we don't use for the treatment of your H. pylori. And similarly, quadruple drug therapy, you should be very much aware of what are the drugs what we are using. Proton pump inhibitors, tetracyclines, bismuth, and as well as the metronidazole. Right, as well as the metronidazole. Okay. So in the place of metronidazole, we can also use the tinidazole. Right, we can also use the tinidazole. Okay. So this is about the treatment of your H. pylori, and the investigation of choice for your H. pylori is biopsy urease test. So some of you are answering it as urease breath test. No, it is not your fecal antigen test. It is your biopsy urease test. So please remember this question, very, very important question, right? Next. Yes, answer this question. Use of spironolactone in chronic alcoholic with the following liver condition. Use of spironolactone in a chronic alcoholic with liver condition shown in the photograph. Decreased edema, improves the liver function, decreases the afterload, decreases the intravascular volume. So first of all, you should be able to make out what is the diagnosis here. See, diagnosis here, it is your cirrhosis of liver. So how can you make out that it is cirrhosis of liver? That is by the presence of your nodules. Right, that is by the presence of your nodules. Now, what is spironolactone? It is a potassium sparing diuretic. Right, it is your potassium sparing diuretic. Treatment, yes, Monica. For spironolactone, what is the purpose for which we give in case of the cirrhosis of liver? Yes, any one of you, please. So, no, I am asking you for what is the purpose of giving spironolactone, Monica? Any one of you, please. Okay, so the purpose of giving spironolactone in a clinical scenario of cirrhosis of liver, it is mainly to reduce the edema. Right, to reduce the edema. Because in patients with cirrhosis of liver, they will have both. They will have ascites and they will also have the pedal edema. Right, they will also have the pedal edema. Now, to reduce this ascites and to reduce the pedal edema, we give this spironolactone, right? We give this spironolactone, and not only spironolactone, we also give furosemide. Right, we also give furosemide. So spironolactone plus furosemide, so which is a loop diuretic, right, which is a loop diuretic that is given in the treatment of edema secondary to cirrhosis of liver, right? So that is very, very important. And what is the dosage? What is the dosage of your spironolactone and as well as the furosemide? See, spironolactone and furosemide, okay? So you take this furosemide, we start at a dosage of 40 milligrams, and spironolactone we start at a dosage of 100 milligrams. And what is the maximum dose that you can go ahead through? Furosemide, you can go up to 160 mg, and spironolactone you can also go to almost maximum of 400 mg per day. Now, when will you increase the dose of this diuretic? Remember, we increase the dose of diuretics by observing the weight of the individual, right? By observing the weight of the individual. So weight of the individual every day, right? Weight of the individual every day in case of cirrhosis of liver, it has to be reduced by half to 1 kg. Right, it has to be reduced at least by half kg. Okay, why? Because you are giving that particular diuretics. What these diuretics will do? Diuretics will flush out the fluid, right? Will excrete the fluid which has been excessively accumulated in cirrhosis of liver. So when the fluids are excreted out, what will happen to the weight of the individual? The weight of the individual should reduce. Now it has to reduce at least by half kg. And not only that, whenever you are giving diuretics, you should also measure the abdominal girth. Right? You should also measure the abdominal girth. So if the weight is reduced, at least half kg per day, and if abdominal girth is reduced, then we can assume or we can predict that the quantity of the diuretics what we are giving is adequate. The quantity of the diuretics what we are giving is adequate. But if the abdominal girth is not changing, if the weight of the individual is not reducing, then in such scenario we have to assume that the diuretics what we are giving is not of adequate quantity. We have to increase the quantity of the diuretics. Okay, so thereby initially spironolactone we start with 100 milligrams, and later we will step it up to the maximum dose of 400 milligrams. And your loop diuretic, which is a high ceiling diuretic, we start with 40 milligrams and we will increase the dosage up to 160 milligrams. Okay, so that is about the usage of spironolactone in decreasing the edema. It is not to improve the liver function, it is not to increase the afterload, and it is not to decrease the intravascular volume. It is mainly to decrease the edema within the individual, right? So this completes the discussion of some of the image-based questions related to your gastroenterology. Now, again in the evening, right, evening we will have one more session, right, at around 4 p.m. or 5 p.m. right. I'll just see my schedule and I will discuss one more session of image-based questions on neurology. Right, I'll discuss one more session on image-based questions on neurology. So please utilize these clinical-based and as well as image-based sessions, which will be definitely useful for your upcoming FMGE exams. Right? Please don't take stress at this moment of time. The more you take stress and the more you get tensed, the hard the exam it will be. Because in stress and as well as tension, you will not be able to revise. Revision is very important at this moment of time. So please revise as much as possible without taking stress or tension of forgetfulness. Because why we get stressed or tensed? Because we forget whatever the things we read. And that is the one which will make up to land up in stress and as well as tension. So please try to maintain your mental stability at this moment of time and try to give maximum effort for your revision for your upcoming FMGE exam. And please inform to your friends also about these sessions, which are the best sessions that should be watched before going your FMGE exam, right? So thank you very much. And again, I'll see you in the evening with the discussion on image-based questions on neurology, right? So thank you very much.